Thank you for being here. Thanks for having me. Please, again, don't hesitate, interject. The field of pediatric sports medicine, of course, has evolved a lot over the past 10 or 15 years, specifically in how we respect the growth plate and still treat sports-related injuries. And I think also the world of pediatric sports has changed very much. If some of you that, and sitting in the seats think back to when you were a child and what the sports world and leagues and church groups and other things and sports, the layout that it was now versus what we're seeing, or then versus what we're seeing now, a world of difference. And so we'll speak to some of that. Again, I don't have any relevant financial disclosures as it relates to this talk. So in outline, we'll talk about youth sports today and how that may differ from the way it was, so to speak, and probably some good things, but also some challenging things that present to us as providers with youth sports involvement now. Overuse injury is by far the more common type of injuries we see in the pediatric sports realm, and we'll define what that means. It's not your all of a sudden acute injury, but more of that repetitive micro-trauma to the immature skeleton where we see overuse problems and how to deal with those. There are some risk factors and injury prevention tips that I can provide you, and you could educate your patients, those that come in for their pre-participation sports physicals or asking about different activity participation. We'll briefly touch on conditioning, and then the idea of burnout, the idea that just like anything, too much of a good thing can be bad. So if you're subjected to the same types of stresses, problems, not only your body but your mind, you probably get sick of it eventually to where it's not fun anymore. I'll make a reference to a website and action group, the Pediatric Orthopedic Society of North America and AAOS, American Orthopedic Surgeons Society, did kind of jointly outreach on sports injury prevention, stopsportsinjuries.org, and there's a lot of useful inputs for parents, coaches, trainers on guidelines, whether it's nutrition, hydration, sports prevention, management of overuse injuries. If we look at the kind of what sports are taking up the majority of kids these days' time, the top 5, basketball, soccer, baseball, football, and gymnastics, and probably all of you could think of a child in the past month or two that has had a complaint or an injury as it relates to their participation in one of these sports. And, there's a whole new definition or meaning to competitive sports at an early age now. This bar graph used to be kind of a slope where, you'd have a low bar and over here that increases as you get older. And this is showing the amount of participation of competitive sports involvement in kids at an early age. So it's the age 5 and 6 where, gosh, if we're not keeping up with the Joneses and involved in this sport or league, then maybe we're going to get behind. So we need to get involved early. Again, that can be a good thing. Team sports, you learn camaraderie, respect for your peers, responsibility, accountability, skill building, but also there can be some challenges that come with that. If you break it down to interestingly, the socioeconomic status and the family unit, not surprisingly, do influence who gets exposed to competitive sports at an early age. And, they say that, kids used to be the organizers of the sport, meaning that you say, hey, me and the guys, we're going to go to the schoolyard and we're going to pick the teams and we're going to make the rules and we're going to have our game. And now the paradigm has shifted. So now the parents and the coaches are the ultra organizers of the sport. And so we're going to do this league and we're going to do travel ball and we're going to do, we might take you out of school and do these extra things to expose you to the sport more. And we just have to be careful with that and keeping the interest of the child and what's fun at the forefront. So we're seeing increased single sport involvement year-round. year-round sport participation and external pressures from parents, coaches, and peers. This idea that, well, we did it for 2 months this year, and if that team keeps playing in another league and we don't do it, then probably your skills won't keep up with the others, and maybe next year they probably won't even want you on the team. And so we're seeing a lot of that. I think gone are the days of the gentleman on the left, which is a guy by the name of Dave Winfield that many in the room might remember from the late 70s, who participated in 3 sports at a high level and did it well enough to be able to get drafted by 4 different professional league teams. And so a true multi-sport athlete. And now today's standard that the kids see would be the gentleman on the right, who, while very good at his sport of golf, was given a golf club at age 2, and this is you, this is your sport, this is what you're going to do. You eat, drink, live, and breathe it, and so that message, I think, is being permeated to the youth. So all of this has then caused our society, again, the POSNA and AAOS, to coin the term the one-sport injury. And this is the notion that early involvement in competitive sports combined with single sport participation year-round sets you up for a lot of the overuse injuries that we see. And it doesn't discriminate between any one particular sport. You see kind of a big 5 up there, and there's overuse injuries and one-sport injuries we see from all of the sports. And this goes further to even into some of the prevention rehab that's being driven now about ACL injury prevention and girls conditioning before certain sports into the therapy world to try to decrease problems that we're seeing. So the typical injury we think of, the 5th grade football player plants, twists, and pivots. He has a non-contact injury with a pop in his knee and an immediate swelling or a fusion, and we worry he might have an ACL tear or patellofemoral dislocation. The gymnast tumbles and lands on a hyperextended elbow and has pain and swelling, and she might have an acute growth center avulsion fracture. Those are the acute or typical injuries you think of, but the overuse injury is the repetitive microtrauma to the immature skeleton, the same stress over and over again. You think of it like the coat hanger analogy. You've been to a coat hanger a bunch of times, it starts to get a little shiny. You just keep doing it. Eventually you can have failure and fatigue failure of that coat hanger, and the immature skeleton is no different. And so when we talk about cartilage growth centers and growth plates, it's those areas that are subjected to the same mechanical stresses. If you asked me the one major difference that separates me from the adult orthopedist, it is literally the presence of the growth plate, the presence of the physis, and how our interpretation, exam, workup, and treatment all respects the growth plate to preserve skeletal growth. So as a youngster, we have 3 types of cartilage that making up the growth plate. So on this side view of the knee, where here's the thigh bone or femur, the shin bone or tibia, and the kneecap or patella in the front. This band of cartilage on the lower thigh bone is the physis or growth plate or epiphyseal plate. All those terms are synonymous. So it's made up of cartilage. So you've got bone, cartilage sandwich, and then bone underneath it. The other type of cartilage is articular cartilage. It lines the tip of the thigh bone, top of the shin bone, and underneath the kneecap. And then the apophysis is a growth center, and it's made of cartilage. And we have several different apophyses or growth centers. So remember that growth plates and growth centers are different. Growth plates or physis contribute to long bone growth, and they're made of cartilage. Growth centers or apophyses are also made of cartilage, but they serve as the attachment sites for muscles, tendons, or ligaments at their bony origin. And there are several different apophyses. We don't have to know them all, but we do have to be aware that these are sites of insertion or origin of muscles. And when that muscle forcefully fires or repetitively fires over time, it is tugging at that relatively weak cartilage growth center and can irritate, aggravate it, and inflame it. So all of us are familiar with some of the more common apophysitis or irritation of the cartilage growth centers we see, like at the heel bone we call Seaver's disease or calcaneal apophysitis. At the upper shin bone, we call Osgood-Schlatters disease or tibial tuberosity apophysitis. There's different ones. We can see iliac apophysitis across the top of the pelvis. You can have a forceful, the soccer player that has a forceful kick, and that muscle that originates on the front of the pelvis pulls off this cartilage growth center, either the ASIS growth center or the AIIS growth center. So you can have avulsion fractures. The hamstrings can avulse off the posterior pelvis. And there's other conditions. There's Syndig-Larsen-Johansson on the base of the knee. There's Iceland's disease, the apophysitis at the base of the fifth metatarsal. And so all of those we see on a routine basis, not just because of involvement in a single sport or too much time in a sport, but just the activity and the growth status of the child. The upper extremity is not immune to apophysitis or cartilage growth center irritation or aggravation. The most common problems we see are in the throwing athlete, so there's no more forceful motion in sport than the throw of a baseball. That amount of torsional force on the shoulder and elbow, that repetitive torsional force, can set them up for problems. So at the elbow, on the inner elbow here, remember that cartilage growth center people call the funny bone, that medial epicondyle? It's the attachment site for a lot of the flexor pronator mass, a lot of muscles in the forearm. And so it's seeing tensile forces in a throw. It's seeing the stretch forces. And the outside part of the elbow is seeing compressive forces in a throw. So you have this constant pulling on the inside part of the elbow and constant kissing forcefully on the outside part of the elbow. And so sometimes we can see OCD, osteochondritis dissecans, on the capitellum of the outer elbow, or little leaguer's elbow, medial epicondylar apophysitis. And the shoulder is no different. The repetitive torsional force, that cartilage growth plate can see stress. That's called epiphysealysis or epiphysitis, little leaguer's shoulder, when that cartilage growth plate is open. Nobody walks on their arms except the gymnasts and the tumblers and the cheerleaders. The upper extremity is not designed to be a load-bearing joint, but in those sports, they're constantly load-bearing on the wrist, elbows, and shoulders. And the wrist oftentimes can see irritation of the cartilage growth plate there. We call gymnast wrist or distal radial epiphysealysis. And they'll have pain in the wrist, sometimes swelling, not commonly, and the growth plate will show widening of that distal radial physis. And we try to restrict the activity, let them do upper body conditioning, let them do core work, let them do things with lower body, but avoid the load bearing. And of course, you can imagine that population trying to slow them down or keep them out of their sport is always a challenge. There's something called tiger paws, which is a brace that they wear that has a metal support that doesn't let them get their hand in that back position. And they'll say, well, I wear it, but it doesn't let me get, so I can't, that's the whole point, so, but it's always something. And the cartilage growth center inflammation problems are typically insidious onset, not an all-of-a-sudden injury, and they're typically something we treat with avoidance of the offending activity, judicious use of anti-inflammatories, even topicals, focused home exercise program, or they can work through a physical therapist, school trainer, what have you, working on optimizing the flexibility and mobility of the muscles around the joint. And generally, 4 to 6 weeks is the duration of time to avoid those things. There's cushioning, protection, decreased friction things, gel cups for the heels, show pat strap for the knees that we'll use sometimes. Remember that, and you guys know this more than anybody, that age is a poor barometer for skeletal growth and development. And nothing demonstrates that better than, say, this example where all these boys are 12 and 13, but this 13-year-old is 7'4". And you can imagine the tensile forces on his growth centers and growth plates is different than this little guy here, who's not that far off in chronological age. But their skeletal stage of development is very different. And similarly, these two girls being the same age on the same volleyball team have very different stages of development, menstrual status, skeletal growth. And it's helpful for coaches and trainers to also keep that in mind when they're developing a conditioning regimen or requirements for their sport. There are things inherent to the athlete that make them at risk for overuse injury. A prior problem or injury to that area does subject you to that. If you go from, they would call it couch to 5K, where you couch potato and then you decide you're going to run cross country this year. Usually in the fall, we see those kids rolling in with all the cross country complaints of 0 mileage over the summer, and then all of a sudden they're running 5 days a week, and their shins hurt, or their feet hurt, or their knees hurt. And then your stage of skeletal growth. If you're going through peak height velocity, you might be more at risk of those apophyseal irritations. And then the external risk factors are things we hope we can control. The amount of time they're subjected to their sport per week, amount of days per week, amount of months per year, relative rest periods, and the types of conditioning they're doing. Good nutrition, a lot of of course, preteen and teenage girls, they're going through the most important part of bone building, peak bone building mass in their life from about age 11 to 18, and most of them are probably not getting the nutrition that they need. And so trying to ask about that and optimize with multivitamin intake, calcium and vitamin D is worth asking about. We're hoping that many of them are getting the pre-participation physicals. A lot of the schools are seeing more of that, which can let us screen for risk factors, problems for the injuries, and address pains before the season starts. It's almost always that volume is the offending problem when it comes to an overuse injury. And imagine an injury threshold where on this y-axis is intensity or stress level of the sport or activity, and this x-axis is frequency. So you can do something high intensity at high frequency at low intensity, and you'll probably be okay. You can do something high intensity but low frequency, in other words, not that often, and be okay. But if you increase frequency and intensity, you get into this threshold or injury region where you're probably going to have issues. And so kind of guidelines of relative rest or recommendation, 1 team per season. You'd be surprised how many are playing on different teams and different clubs or travel teams at one time. So 1 team per season is the smartest thing to do. You need to be off at least 1 day out of the week and 2 to 3 months out of the year from that sport. The guideline or easy rule that we see broken all the time is no more hours per week of the sport than the age of the child. You have plenty of 9-year-old gymnasts that are doing 30-hour weeks of competitive gymnastics, and so while that's admirable that they can make that commitment, it's also challenging to keep their bodies without having troubles. Something I'm going to say about that. I don't know what it was. Okay. I know what it was. So think about it as an adult. If you go exercise and you say, well, this week I'm going to run 6 or 7 days a week. Well, I know me, my knees are going to feel it, my hips, my back, my feet. Whereas if you cross-train, you're probably going to be a lot better off. So you could swim 1 day, bike 1 day, run 1 day, do weights 1 day, and you're probably much more sustainable. And the same message to kids, but in a different way, can be helpful. So yeah, I understand that you love this sport, but adding different sports throughout the year is helpful. Or I understand you love this sport, but maybe we're going to cross-train and do this type of conditioning during your off season or your 2 to 3 months off a year, so your body sees a different type of stress. We don't want you to play through pain. Kind of an old mentality. Some of the coaches would just, hey, suck it up, get back out there, and if your growth centers are open, growth plates are open, we really need to investigate that before just telling you to suck it up, push through it. And return to play, we need full recovery, and there's really 4 criteria. If somebody's had an injury or a pain or problem, and we send them to therapy, we try to tell the therapist there's 4 criteria before return to sport, which is full range of motion equal to the other side, 90% strength of the unaffected side, demonstrate sport-specific function without pain or problems, and be psychologically ready. What that means is you can imagine if you had a gymnast dislocate their elbow or a cheerleader and they go through 2 or 3 months of recovery and rehab from that, they sometimes don't really trust that their arm is good to do what they need to do. And so it's got to be that kind of sport-specific therapy that simulates in a supervised, spotted fashion before return to sport in a controlled setting. The training programs often focus on some of the important skills that can cross over at any sport: balance, coordination, flexibility, neuromuscular control. And a lot of times that goes into this next question, which we get a lot, is strength training safe in youth? And the short answer is yes, but the longer answer is some of the things we will touch on. Body weight beats weightlifting. Body weight lunges, body weight squats, push-ups, pull-ups. Those are easy things that are safe to get involved in an early type of weight training regimen rather than getting into a gym, because you need the proper supervision, you need the proper technique and teaching before you start that. Is there a minimum age? Can pre-pubertal kids build strength? Can weightlifting stunt growth? Generally, after the age of 10, if someone wants to engage in a supervised, starting light, higher reps, lower weight program with a parent or a trainer, I think that's safe, provided they understand the goals. The goals are, you don't have enough circulating testosterone in the male body at that age for muscle hypertrophy, meaning that you can try to put them through all the weight training they want, but you're not going to get muscle mass as a result of that because they just don't have enough circulating testosterone. You can, studies have shown, refine the muscle memory and increase the efficiency of the muscle by using safe and low-intensity weight training. So proper warm-up and cool-down, proper supervision with the right goals in mind can be safe. There are no studies that have shown weight training stunts growth. In other words, that physeal arrest occurs as a result of weight training. But you can imagine that when the guys get together and they want to see who can lift the most weight, our recommendation is to avoid the 1 RM, 1 repetition maximum. You don't try to max out, so to speak. You're trying to do lighter weight, higher rep. Okay. Any questions up to that point? Anything we touched on? See how we're looking on time. Okay. So we talked about overuse injury. We talked about some of the challenges with pressures on kids and youth sports these days. And that brings us to burnout, which can be a real problem in youth sports as you get into the preteen and teenage years. Because you can imagine what started out as fun now feels like a job or something mom and dad or others want me to do that maybe I don't really care to do anymore. And so we have to pay attention to that. Interestingly, there's a psychologist, a sports psychologist by the name of Dunning, who polled a lot of junior high and a lot of junior high kids, 6th, 7th, 8th grade, and said, hey, I want you to draw in a little colored dot on this little graph or axis of your participation in sports and where you see it fit. Do you see it non-competitive or competitive? And is it serious or is it fun? And look at the density of the plot here. And so you can imagine that, maybe up in the left corner here might be like a church league or something. We don't expect to be up there. But you would like to see a lot of the dots, above this line, suggestive that, competition can be healthy but still fun. And food for thought. If you look at an NCAA burnout study and you ask all the athletes that were going to go Division I and then just gave it up, 70% of them, boys and girls combined, said that it really just wasn't fun anymore. They were probably in that lower right plot. Injury takes a lot of them, and then they realize, well, maybe, 10 years from now, this isn't what I'm going to be doing, so maybe I should focus on what can carry me into career and building family and that sort of thing. One of the most common misconceptions, and we see it by actions but also by words in the middle school age group I think the most is that, I tell you what, you're good at this at age 8, so you really need to focus on that at the expense of other sports, because if you just focus on that, kind of that Tiger Woods mentality of what I was talking about, then you'll really make it. And if you take 300 of the creme de la creme, these are Division I NCAA male and female athletes, and you ask them, what age did you specialize in single sport? 7 out of 10 say no specialization until after age 12, and 90% of them played at least 2 or 3 different sports throughout childhood. And so that suggests that if they're like if that's your end goal, that Division I and scholarship and maybe even professional, the notion is flawed that you've got to get on it early. And if you break it down by sport, percentage of Division I males who specialize by age 12, certainly less than half for most sports were specialized before age 12. Soccer and tennis being the 2 exceptions, and ice hockey. This slide I thought I deleted. This was a slide I had for a coach's talk that shows that the importance of the coaches cannot be overstated, meaning that the influence of a coach to somebody who's young and vulnerable, and somebody that is a high school student or junior high, the coaches have a lot of influence on them, and a lot of kids will cite a poor relationship with a coach. Just like I think of it as, say, hey, why'd you go into pediatrics, or why'd you go into orthopedics? You think back, a lot of it, you were exposed to somebody that you really looked up to, and you say, gosh, I really like the way they do their job. I like the way they interact with families and kids. I think I want to do that one day. Whereas if you had a rotation that really rubbed you the wrong way, and you say, man, golly, he seems miserable, and he's mad at life and doesn't enjoy what he does. Boy, I don't like urology or whatever it may be, So nothing against any urology, but the media, like many things, and again, nothing against the media, but the media does not help because there's, for example, this little guy on the left they call Joey Baseball. Joey Dracy lives in New Jersey. He's age 10. They did a write-up on him about how he has a batting cage in his backyard, and his parents estimate they spend about $25,000 a year on his baseball, from a pitching coach to a hitting coach to travel ball to not the school league but the showcase leagues and others. Or the girl on the right who has really excelled in soccer at age 11, and so they've pulled her out of school and they're doing homeschool so that she can focus on her sport. Interestingly, someone in our society is famous for saying, imagine if we put the same amount of energy as parents into their schooling and academic education as some parents do into their sports. Imagine what we'd be creating and sustaining long term. And I know I'm preaching to the choir probably in here, and it's not like everybody in here is like, man, baseball every weekend, like that's but you're the providers that can help kind of take the parents out of that, give them that 20,000 foot view sometimes. There's a Netflix documentary on AAU basketball and the sensationalization and popularization of AAU. The idea being that it used to be that if you're a really good basketball player, you need to get on your high school varsity team because the college coaches are going to come to your high school gym and that's where they're going to see you. Now, high school team is pretty much meaningless. You can play on it, and they probably will, but AAU is where it's at because AAU, they get the Nike or Adidas sponsorships for the teams, and then the Division I coaches will travel to the different tournaments and watch the kids. They'll even go, these AAU teams will go to the high school games and look at the superstar on the court and watch the mama that's screaming the loudest to go pick out, okay, that's the superstar's mom. They go sit by her, talk to her, recruit her to the AAU team, and get them on. They build this AAU team dynasty. Very interesting. It's male, female sports. We see it in all of them. The girls used to be club teams were sort of like, an uncommon or elite thing that only a select few do, and now club teams are sort of like, what club team are you on? That's kind of the standard, and if you're not on a club team, then maybe you really don't care about the sport. CNN talks about the 2.5 minutes of perfection. Cheerleaders spend 365 days a year for this. I think there's 50,000 girls in Florida and Orlando on a February where they go and for 2.5 minutes they perform, and that's kind of this trophy that they envision. And all of this can be, there can be good energy and good healthy. We just have to be careful as providers that we're making sure that the child's interest is at heart. Most people can probably, there's a psychiatry diagnosis that's been popularized by a psychiatrist named Ian Toffler called achievement disorder by proxy. And probably everyone in this room could think about maybe somebody that they know or have seen that maybe identifies with this, where dad or mom, but say dad was not able to excel to the level that he wanted to in his sport when he was younger. And so, by golly, now that I've got Johnny, my son, I'm going to make sure he has everything possible to allow him to excel to the level that I never got to. And so then Johnny's at the middle, and they start to surround Johnny with, the external pressure of the family. Man, this is your sport, this is what you got to do. Then he starts to get an entourage. He's got the coaches, the trainers, the pitching coach, the strength trainer. He's got the nutrition specialist. I mean, these are obviously extreme things I'm talking about, but these things are out there. And then the larger systems, and all of a sudden Johnny's in the middle going, I don't really even like this anymore. And everybody else is going, what do you mean? This is us. This is what we're doing. And so achievement disorder by proxy, it could be in, you could insert whatever sport or realm you're talking about. It can apply. There's if anybody watches the ESPN 30 for 30s, it's basically 30 different stories about prior athletes, and there's one on Todd Marinovich, which is an achievement disorder by proxy story essentially, because Todd Marinovich was the son of Marv Marinovich. Marv Marinovich was the first ever strength and conditioning coach in the NFL, and Marv himself played linebacker in the NFL and was very good, and he had a son Todd, and he thought, well, I'm going to make Todd the best quarterback that's ever lived, a robo quarterback. So starting at an early age 4 and 5, he'd have him working out. And when other kids could go to birthday parties and have cake, Todd could have an apple or a banana at the party. And when other kids went to spring break, Todd was going to sports and training camps. And it goes on to talk about how Todd did well and went to USC and played quarterback, and then went and played in the NFL. But as soon as he got into college, as soon as he got that little ounce of independence, you can imagine what happened is the drugs and the crime and everything else that you can imagine. If you have your thumb down on somebody for long enough and then you get the independence in college, you create a monster. So I think the message, as we all know, the emphasis should be on fun. It's helpful to know about the regular or common overuse injuries we see and things we can do to help prevent them. Early specialization, I think across the board, is probably not smart. And if you're going to specialize early, cross-train or introduce other things that can keep you out of trouble. And we don't want to push through pain. Pay attention to symptoms early. A couple of resources for you. The StopSportsInjuries.org resource is very reputable for a lot of good information from parents, coaches, trainers, physicians, therapists. And then the One Sport Injury, orthoinfo.org/onesportinjury. And those are, websites you can literally give parents, say, hey, go here if you have questions about pitch counts, or you have questions about weight training safe in youth, or you have questions about proper warm-up and cool-down for your sport. It's all broken down sport-specific: volleyball, lacrosse, gymnastics, cheerleading. Most of you may be aware the Freestanding Children's Hospital is slated to open October 5th, 2019 in Baton Rouge. We're excited about it. It's right there on I-10 in Baton Rouge, and we excited about what that'll do for our state and our region. Happy to open it up to any questions or things you guys have about what we talked about, or how I can be a resource for you and the challenges you're seeing in daily practices. Thank you for your time, for sure.